Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. So I'm continuing on with part two of my video for insurance denials and appeals. So I'm going to encourage you to go back and watch part one before continuing on with this so it makes more sense to you. So continuing on, the next phase of the appeal process would be to request a peer-to-peer review. And your doctor can request that. Now, if you want to wonder why sometimes your doctors fall behind, it's because they have to take time out of their day to call an insurance company, perhaps wait and wait and wait on hold, just to talk to another doctor at the insurance company, who's basically the insurance company's reviewing physician. Now, it's called peer-to-peer review, but that doesn't mean that your doctor is going to talk to another doctor on their level. In other words, a cardiologist may not be talking to a cardiologist at the insurance company. A pulmonologist may be speaking to a podiatrist, which instead of a lung doctor is talking to a foot doctor. But there's good and bad with that, because even though the reviewer may not be in the same specialty, it may work out that the doctor you're dealing with may be able to explain things that this reviewing doctor simply can't argue against. Whereas if you are actually dealing with a peer on the same level, then that reviewing doctor is going to be very well aware that the cardiologist knows what he's talking about, knows what needs to be done, and it makes it harder for the insurance reviewer doctor to argue that. So the point is a direct conversation can clarify any complexity of the particular case. And doctors tend to advocate strongly when they're engaged professionally. So, of course, we're hoping when it gets to the level of a peer-to-peer review that the conversation is kept professional. You can escalate to an external review. If the internal appeal fails, you have the right to an independent external review under federal law. This is a federal law. It's called the Affordable Care Act. Okay, and with that, an external reviewer, this is somebody not employed by the insurance company, and they make a binding decision in many cases. So you have to find your state-specific instructions of what to do through your state's Department of Insurance, usually found on your state's website. You can file a complaint with regulators, depending on your type of coverage. If you have private insurance, you file a complaint with your state insurance commissioner. If it's Medicare, you contact the Centers for Medicare and Medicaid Services. And if it's employer-based, you have the option to involve the U.S. Department of Labor, which is ERISA plans. So regulatory complaints often trigger a re-review. And again, I said it earlier in the other video, check if it's a coding issue. Okay, sometimes the wrong billing code was submitted. That's simple. Or the diagnosis code doesn't justify the test. Sometimes providers forget to get that pre-authorization. Have the doctor's office double check what's called the CPT and the ICD-10 codes. That will also help. Use evidence strategically. Okay, make sure if the denial says that it was experimental, ask your doctor to cite specific guidelines, standard of care publications, and concession or consensus statements. Okay, insurance companies often reverse when they're shown that it's standard practice. Now, if you're in an urgent or cancer-related situation where delay obviously would seriously jeopardize the health, you request an expedited appeal. They must respond faster, and sometimes it's within 72 hours. Now, given what you want is the doctor to state, because language matters. delay may materially affect prognosis. Okay? If all else fails, you have other options. You can negotiate cash price. Sometimes they end up being lower than the billed rates. Sometimes they call that requesting Medicaid rates. Hospitals also offer financial assistance programs, and sometimes a legal consultation wouldn't hurt, especially if the denial contradicts the policy language. So there's a psychological strategy that you have to understand. Insurance companies operate on time pressure. They count on administrative fatigue. The doctor is just going to give up. And they're going to hopefully expect that the patient gives up on fighting. But that persistence alone wins many appeals. They count on you giving up, and you can't do that. You have to keep pushing. So, of course, this all circles around to my constant fight for universal health care. And those who oppose it come up with one excuse after another, and even after it's proven to be the advantage. At the end of the day, it's the mere fact that some simply just don't want the government in charge of their health care. You know, these are people who are willing to pay over $20,000 a year for a private entity to deny them health coverage, as opposed to what's already being taken out of your paychecks. Look at your pay stub. It's called the FICA tax, FICA, which contributes to Social Security and Medicare. It's an amount, usually I think it's around 15.3% total. It's split in half between Social Security and Medicare, so that amounts to 7.65% going to Medicare. You're already having that taken out, okay? So it's already being paid along with whatever you pay towards your private insurance. So if you're carrying other insurance, you're carrying double the amount of what you need. Now, Medicare has a much lower, if any, denial rate compared to private insurance. Okay, and more importantly, there are stronger mechanisms for Medicare to fight any delays or denials. But then the argument falls back on, I don't want government controlling my health care, or wait times, which already exist, or you can't see who you want. With a private option, you can, or whatever excuse those who oppose want to throw out. It's against our best interest to oppose universal health coverage, which is why every other industrialized country has it except for us. Because in the US, health insurance is not about patient care. It's about profit over patient. And because of that, good luck with your appeals. Until next time, this is Paul's Heart.